Hello everyone, I would like to welcome you today to this short presentation on the Radiotherapy and Oncology programme here at Ulster University. But before we delve into more details about the programme, it's probably an idea to define what is radiotherapy and oncology. So oncology is the study of cancer, and radiotherapy is the treatment of cancer using ionizing radiation to eradicate or to manage tumour progression. So the Radiotherapy and Oncology programme provides education and training for future therapeutic radiographers in this area. And for students who are interested in a career in radiotherapy and oncology, a wide skill set is needed. So you need to have a good knowledge in science, as you will be working with ionizing radiation, and the job entails using sophisticated equipment to accurately deliver radiation treatment to patients. Another skill that therapeutic radiographers require is to be able to work well as a team member. In some professions, working alone is the standard, but in therapeutic radiography, radiographers work in pairs or work in teams of up to 4 per team. Another important skill is to have good communication skills, not only to be able to communicate and interact with other members of staff, but more importantly, to be able to communicate effectively with patients and their families. Currently, the Radiotherapy and Oncology programme is located on the Jordanstown campus. However, in September of this year, 2022, the programme will relocate to the Magee campus in Derry, Londonderry. And so for those students who will join the programme in 2023, all the teaching will be on the Magee campus. So Derry, Londonderry is regarded as Northern Ireland's second city, and the campus is ideally situated for exploring the northwest of the country. There are some beautiful landscapes to see, there's lovely coastal towns to explore, and some beautiful beaches too. The city also has lots of coffee shops, it's got lots of bars, it's got a vibrant nightlife, as well as craft shops, theatres, and at certain times of the year, the city hosts cultural festivals. Another very positive point of being located in Derry, Londonderry, is that it is one of the most affordable places to live in the UK. So this is quite appealing, particularly if you're a student and paying for your own accommodation. And it's also good news for family members if they are perhaps paying or helping to pay for your accommodation as well. So in this brief presentation, we're going to look at why you should study radiotherapy and oncology at Ulster. We're also going to look at what you're going to learn, so the various different aspects from patient care through to oncology to radiation physics. We will look at how you will be taught. We use obviously various teaching methods to ensure that there is a variety to suit all learning styles. And we will look then at how we will support you during your journey through the programme. So again, we have a variety of supporting mechanisms in place to help and assist you with that transition to university life. And finally, then we will take a look at some of the job opportunities and positions that are available on successful completion of the programme. So why study radiotherapy and oncology? Well, our cohort sizes are small. So each year we enroll between 14 to 16 students onto our programme. And we are limited to these numbers due to our practice placement spaces. So from the onset, we get to know our students extremely well. We have great communication, and we do get to build up a rapport with our students. We have 4 dedicated staff who are very approachable, and we also offer an open door policy. So there's no need to sort of book an appointment to see us. We are always available most of the time to assist and support you on your journey. Again, we also realise that most of our students come through the traditional route of being in secondary education, and then this transition into third level education can be quite daunting for some people. And so from the onset, we have studies advice service set up in the year one. So you work along with the studies advice supervisor. They can assist you with any issues you have or any concerns you have with the module content. They can discuss time management skills, and they can just offer simple advice on how to progress successfully into the next semester and into the subsequent years. Again, we have assigned a personal research project supervisor to each student in their final year of the programme, and you will work closely along with them to produce a research proposal. Again, we have first-class facilities at our Magee campus. We were the first to install the virtual environment for radiotherapy training, or also known as our VIRT. And this is a virtual environment which allows students to work and practice their skills in a very safe and non-pressurized environment. And as we know, we can all appreciate that our hospitals are very, very busy, and there's a very it's a very fast-paced working environment. And so having this VIRT suite allows our students that time to practice their skills in setting up patients in preparation for their practice placements. Again, it also helps you to develop your skills and to refresh your knowledge as you progress through the program. We also have a treatment planning system. Again, students will get that opportunity to plan specialized radiotherapy treatment plans for the patients. And finally, we have a fully integrated professional practice schedule in place. So students will go out on professional practice on each year of the course. Again, we have excellent support from our placement providers. In fact, we have set up an education group where academic staff from the University of Ulster and our clinical staff from the cancer centres meet on a monthly basis. And we discuss the progress, and we get to discuss any issues or concerns that may arise as a result of the practice placements. Again, we have dedicated clinical tutors and practice educators on site to assist and support you during your professional practice placement. So what will you learn? So you will learn the skills and the competencies that you need to become a therapeutic radiographer. So the programme delivers a combination of modules, both academic and practical sessions. So the academic subjects include human anatomy, so looking at normal anatomy. Obviously, you're going to be working along with patients, so it's imperative that you understand the anatomy of the body. Again, we look at how the body systems work in physiology, and then we look at the body in a state of disease, which is our pathology. Then we move into other areas such as physics, so radiotherapy science, so the production of X-rays, and radiobiology in terms of how radiation actually interacts with our body tissues. Again, another important area is radiation protection. So not only are you learning to and understanding how to protect our patients from unnecessary ionizing radiation, but you're also considering protecting yourselves as staff from radiation. And finally, oncology and patient care. So oncology and patient care is embedded throughout all 3 years of the programme, and patient care is another skill that therapeutic radiographers acquire, and it really is at the forefront of everything we do on a day-to-day basis. And finally, we have clinical studies and professional practice placement. So we have over 38 weeks of professional practice placement embedded within the course as well. And here you get an opportunity to actually work alongside qualified therapeutic radiographers. You get to get hands-on experience and get to see exactly what you do as a therapeutic radiographer. And this is just a professional placement practice schedule. I thought it was quite important just to highlight the areas and the times of when you would be expected to be on placement. For a lot of non-allied health professions, courses tend to have a semester 1, a semester 2, and then you have the summer months where you would have the whole summer to go on holiday and enjoy yourselves in preparation for the next year of the program. However, with a lot of our allied health professional programs, a lot of our placements are actually scheduled for the summer months, and these placements are mandatory, and you must complete the 38 plus weeks in order to fully successfully progress to graduation. So you can see there in the schedule, we have a placement 1, placement 2, and then the summer. So your year 1 would really start with 12 teaching weeks. And this allows you to sort of settle into university life and to get a feel for the topics and the subjects that you're going to be covering. Then this is followed by a revision week, and then we have a 2-week break for Easter. Following this, you come back in the January, and this is where you would have what we call orientation placement. And this is a great opportunity to really get into the hospital and see exactly what therapeutic radiographers do on a day-to-day basis. So you're there for 3 weeks, mainly observing and just getting a feel for that sort of hospital environment and just sort of starting to build up your communication skills with patients and staff. Then we move into semester 2. Again, you have 12 teaching weeks, followed by 1 revision week, and then we have a 3-week examination period. And during this time, this is where you would undertake any of the module assessments. And then we move then into the summer months, and you can see there that the first placement is divided into 2. So we divide the cohort into 2 smaller groups. So the first group would go out on placement between the months of May and July, and then the second group would be on placement during the months of July and September. After that, then you come back to year 2, and then you sort of come back into sort of covering some academic work in the first 8 teaching weeks, and then you will complete the remainder of your placement 1 during the months of November, December, and that's just a 4-week block. This is then followed by another 3-week exam period. Semester 2 follows the same pattern as in year 1, where you have 12 weeks of teaching, a revision week, and then an examination period. And then you move back into the year 2 summer, and then you will undertake your professional practice placement 2. Again, it follows the same pattern as in semester 1. So you can see there that students in year 1 and students in year 2 are actually out on practice placement at the same time. Now, this is a great it's a great support if you are a year 1 student, because you are obviously getting to work alongside some more experienced year 2 students, and equally year 2 students actually love that responsibility to actually sort of take on the role of mentoring our new year 1 students. So the student feedback has been very, very positive, and both cohorts enjoy this particular setup. Finally, then in year 3, the first semester you will have 12 teaching weeks, and then in semester 2 you move into your final practice placement. And here this is a much longer placement, which spans over the months of January to May. So it's an 18-week block. And in here you have the opportunity to go to other institutions across Europe. You may wish to stay or remain in the UK, but it allows you that opportunity to visit other cancer centres to experience their techniques and obviously their setups. So how will I be taught? So again, we teach in a number of ways. The majority of our teaching is through lectures, mainly face-to-face delivery. In some cases, we undertake seminars where students will be given directed reading to go and research a new topic or a topic of interest, and then we all join back together on campus and we discuss these new findings or developments in a seminar. Again, practical sessions using our VERT system or our treatment planning systems. And again, you would be asked while you're on placement to identify a particularly interesting case of a patient where you would follow them from diagnosis right through their cancer journey. Following that, you would come back onto campus then, and then you would present this to the rest of the cohort. A professional practice, then obviously all the theory that you're learning in your academic studies, you get that opportunity to marry your theory and your practice together. And you're also learning those clinical skills along the way. And again, some of our learning or our teaching is actually online. We do have a platform, a learning platform called Blackboard Learn. And this is where all the program resources or our teaching resources are uploaded for students to access 24/7 basically. So some of this online learning is complemented by our lectures and our seminars. Again, assessment of the module content can be through exams, it can be through pieces of coursework, and obviously your clinical performance while on placement. So I suppose it's important at this point to acknowledge the fact that this is a 3-year full-time course. So you could be expected to be on campus 5 days a week, Monday to Friday. As we mentioned before, the semesters are divided mainly into 12 teaching weeks, but obviously because you will have placements, some of those semesters may have 8 weeks or they may have less than that. Obviously, we will obviously reassess and reevaluate the course as we move forward. But it is interesting to show that how many hours per week you would be expected to be in class. So you can see there, as we move through the year groups or through the program, the hours that you're expected to be in class decrease. Now, this doesn't indicate that the workload gets lighter or that you have less to do. In fact, what it does mean is that we are moving towards a more student-centered approach to learning. So that means you take on more autonomy and more independent learning. Again, when you go out on your professional practice placement, you can be expected to be at the cancer centres between 8:30 and 5 p.m. Obviously, that depends on which department that you're assigned to. And I suppose at that point I should mention that we use 2 of our cancer centres. One of them is the Belfast Cancer Centre, which is located at Belfast City Hospital, and it would be our bigger department. It has 10 linear accelerators. The linear accelerators are obviously the machinery that we use to deliver the radiation treatment. And we have another centre which opened in 2016 at the Northwest Cancer Centre. Again, it has 4 linear accelerators, so it's a much smaller department, and it's located at the Altnagalvin Area Hospital in Derry, Londonderry. So we use both of those sites for our placements. So how will we support you? So as we mentioned previously, we do have a number of support mechanisms in place. So we do have the studies advisor to help with that transition from secondary into tertiary level education. We have the peer mentoring when you're out on your placements. We also recently brought in a new system called Buddy, the Buddy system, and this is where students who go out on placement are assigned a buddy, and this buddy is a qualified therapeutic radiographer who will be working on the treatment units along with you. So again, you can seek advice from them. They will support you through your placement journey. We mentioned before we have the Blackboard Learn area, so all our resources for our program are available there. And we do appreciate that nowadays the majority of students do have part-time jobs, or in cases some students have other family commitments. So having this resource available 24/7, it allows sort of for a more flexible learning approach. We've got great library resources as well. All our recommended texts are available to borrow from the library or source online. And again, we do have a wide range of student support services available at the university. So I thought it was just nice to mention as well how we sort of coped during the pandemic. Obviously, we always strive to deliver our teaching face-to-face. However, we were in a position where that wasn't always feasible, and therefore we had to then resort to online teaching. So the this was either done by synchronous or asynchronous delivery. And the student feedback on this sort of online delivery was actually very positive. And what we've learned from this is that there are other ways that we can use technology in our teaching approaches. So in terms of future careers, so on successful completion of the programme, you will graduate as a therapeutic radiographer. And many of our graduates go on to work as therapeutic radiographers in the NHS setting. However, there are some who choose private clinics, and I'm not aware that there is any at the moment in Northern Ireland, but there are a number of private clinics in the Republic of Ireland that some of our graduates have taken up employment. So on completion of the course, you're eligible to apply for registration with the statutory regulatory body, the Health and Care Professions Council, or also known as HCPC. So you can't practice as a therapeutic radiographer without being registered. Again, you have the opportunity to become a member of the Society and the College of Radiographers. Again, as a graduate, your starting salary is around 25,000, which is quite modest considering you're a new graduate. And you can actually move up the incremental scale quite quickly once you gain employment. At the moment, there is a shortage of radiographers in the UK. So if you're prepared to travel following your graduation, I can't see any issues of not being able to seek employment. So we do have this shortage, and we've had a shortage of radiographers, particularly in the UK, for a number of years now. So I can't foresee that becoming any easier. However, 95% of our students are in employment or in future study within 15 months of graduating. So there are opportunities, obviously, for our graduates to branch into other roles, such as radiography research. You can branch into other roles, radiotherapy treatment planning, and there's also advancement in the roles of prescribing radiographer and pre-treatment radiographer. So just to conclude then, if you are considering a course, or if you're considering a career in radiotherapy and oncology, then you can access the UCAS code that you need to access the course will be B822, and you can see that at the top right hand side of your screen, or alternatively you can actually just scan using the barcode. And again, just to mention, I did talk there a little bit about our placement, professional placement, and the fact that most of our placements are in the summer. However, there was a placement there that appeared in semester 1 and year 2. So we do, review our courses continuously, obviously to take advantage of our new sort of teaching approaches and developments in the profession. So therefore, what you see on that schedule today may not be exactly the same as it would be for your year of entry. So that's just something to bear in mind. Again, the entry requirements for the course are published on our website, and normally for those coming through the traditional route from A level, we normally ask for GCSE physics, and we ask for 3 Bs at A level, and one of those subjects must be a science. For other information on equivalencies or any sort of questions around any specific circumstances, you can email the admissions at ulster.ac.uk. So if this is the career for you, apply now to your UCAS, and hopefully we get to see you in 2023 at Ulster.